Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. Bring balance back to your cells with Natura tissue salts, the one in the iconic purple bottle. According to Dr. Schussler, the pioneering physician who first developed tissue salts, the human body relies on 12 crucial mineral salts for healthy cell function and well-being. He recommended homeopathically prepared microdoses, ensuring rapid absorption into the bloodstream and cells. Anyone can incorporate the 12 Natura tissue salts into their daily routine. They are easy to take, even for little ones, as they dissolve in the mouth and can be used daily for common niggles, such as a runny nose, or for muscle aches and spasms, or when you experience a loss of mental vigor. Use Natura tissue salts daily to empower your cells and unlock vitality. Natura has been a trusted manufacturer and provider of tissue salts to South African consumers and professionals since 1966. Visit www.natura.co.za. Hi everyone. Welcome to another episode for the Birth and Baby Advice You Can Trust show. And as you all know me, I am Margreet. I'm the host of this show. And today I'm actually also going to be doing the talk. So there's no guest. And I'm actually so excited that I get to spend some quality time with you here. But first and foremost, I want to say welcome to 2024. It's the first podcast for the new year. And I'm just so excited about this new year for many, many reasons. It's obviously always nice to start a brand new year. It's like an empty canvas, and it's a whole story to be told. But we also are having some really exciting plans with this podcast and with all the things we do with Sensitive Midwifery and Sister Lillian Center. So if you are new to the show and you don't know me, I am a midwife specialist, proudly so, and I've worked in many different ways as a midwife on grassroots levels, running a clinic, being an independent midwife, working in government sector, private sector, and with all of my learnings, the golden thread for me was that, hey, we as midwives and as women and healthcare professionals, we really need to return back to the basics. We really have over-medicalized birth, and there's so many factors that has come to play why we do that. Birth is, and pregnancy for that matter, is loaded with fear. Money has come into it, litigation, and all those things. So I was on an academic journey where I've also been able to put evidence behind all of this, and I'm really passionate about scaling up midwives and empowering women to have the best birth they can actually have. And yes, it's good that we have medical interventions, but it's not good if you overuse it. So WHO, which guides our guidelines in every country, has also realized that we've gone way too far into medicalizing birth, and that we need to go a bit back. So the pendulum has to shift back, where back in the day we probably didn't know anything much for medical interventions, and we might have lost some moms and babies. Now we know too much and we intervene too much, and it's also not benefiting moms and babies. All right. So for today, there's too much I can say about medicalization, but for today, we are going to focus on labor and birth positions. Now, if you look back in history, you will see that if you look at all the pictures and archives, history that have any knowledge about birth, you'll see that moms are always depicted in the pictures in upright birthing positions. Some form of upright birthing position, whether it's squatting, standing, or using something like a support, a kind of stool. Women were always giving birth in an upright position. We never see women lying on their backs. Well, if you would ask a mom now, like, what is the best birthing position? She will most likely say I give birth on my back, because that is sort of has become the norm in and around us. And actually, I've also come to realize that most of the midwives also think it's the only birth option, birth position, and that is just not right. So last year, I've done a lot of workshops amongst midwives on labor and birthing positions, and it was just fascinating to be with midwives that are so experienced, and yet they've never done a birth other than a woman lying on her back. And it's understandable because they get taught that way. So if you need to do it any other way, you feel actually out of your depth, really. So as much as midwives might maybe be aware of it, they've engaged with our material and they've been exposed to different birthing positions, they still feel incompetent or not confident in doing them. So there's a lot of empowerment needed. But then once we empower midwives, or midwives that are very knowledgeable about it, they actually also said, but the mummies want to give birth on their back, because that's probably what they think is the norm. That's what they've seen in the movies. That's what I heard the others have been doing, and that's what I've done with the previous births. So there's something that we need to do for all women that give birth and all birth workers that are involved in birth, is to train them about different birthing positions and labor and birthing positions. So what are then other kind of birthing positions that you can think of? Well, I've already mentioned a few in the beginning, like standing or sitting. But then there's something like squatting, which is quite a normal position to be in. You can imagine squatting can help you to really bear down properly. But even something like lying on the side is a good birthing position instead of lying on the back. But why is it that we want those different birthing positions? Oh, if you look at how women's bodies are designed, we are designed for birth. But if you look at how birth works and how the pelvis is made, you would never want to be on your back. Okay, so our pelvis is actually made in a way that it can open up and get a bit bigger when we give birth. First and foremost, it's through hormones that change when we're pregnant, the relaxin and progesterone. They make that our ligaments go a bit softer, and the pelvis therefore can expand during birth a little bit, up to, if there's proper space given for the pelvis, it can even be 1.5 centimeters. Can you imagine that? Then obviously the baby's head is also made to change shape, and the head is soft, and it can find its way through the pelvis. Then the pelvic outlet can move open, so the coccyx can actually move backwards. So normally when you look at the pelvis, it has got a slight bend, and it goes a little bit forward. If you would stand, it will bend forward. So that is the way the baby would come out. And then just imagine now, if a woman is lying on her back, then that baby needs to make that turn and the bend upwards. So it goes against gravity up in the air. Also, when she's lying on her back, that pelvis doesn't have all the freedom to open up and expand. The coccyx can't move away, so there's less pelvic outlet. So now you can think like, that's why we have so many problems. That's why we have so many babies that take forever to come out, and then we feel we need to interfere, or that's why we have so many seizures. And unfortunately, if you look at our cesarean section rates right across the world, it is rising, or it is already very high. And that is because we have forgotten how natural birth is. And we have over-medicalized it, and we've put women on their back. And if you would see in history, when the back birth started happening was really when doctors became involved, when we started to learn more about medicine and we wanted to see exactly what's going on. I've been told that the first time a woman was documented giving birth on the back was for a French king that wanted to see how his women give birth, and that's why she needed to be on the back, that he could really see what is going on. And that is really the truth. Still today, why women give birth on their backs is for healthcare professionals to see better what's going on, but it's not best for moms and babies. So what is best for moms and babies? For birth is for you to have freedom of movement. So there's no best birthing position. The best birthing position is the one that feels most comfortable for you. And if a woman goes into labor, she will want to be in different kind of positions. And no one really have to tell her what those positions are, because she feels what's going on in her body and what feels most comfortable for her. And as professionals, we just need to encourage her to feel safe and to take the movements, do the movements she feels comfortable, and take the positions that she likes. And sometimes you might need an encouragement or a suggestion if something is not comfortable, like, why don't you try this? Why don't you try that? But definitely movement is so important for that baby to navigate its way right through the pelvis and on the way out. So it already starts during labor, not only when you give birth. When you're in labor, different positioning is what you need to do. That way the baby the labor will progress faster than when you're lying down. Gravity is at work. The head can navigate its way through the pelvis downwards. There's quite a few turns that a baby wants to make to wiggle itself out there, and that's why different positions are extremely important. All right. Now, then when you are ready to give birth, you might just want to stay in a position that you've been all the time. Like I was with a birth the other night, 2 nights ago, and that birthing mama could only stand. She was getting tired for just wanting to stand, and she was wanting to sometimes just sit down, but then she would sit down for a bit and just want to stand up. Something was in her body the most comfortable when she was standing. Everything else was very sore and uncomfortable for her. So guess what? She also ended up standing while giving birth. That was sort of what her body needed, what was the most comfortable position for her. So oftentimes what is comfortable during pregnancy, labor, you might just end up doing that when you're ready to get that baby out. And I've seen with all my births where it's active birthing, those births really go smooth and fast, much faster. The second stage, from the moment you push your baby out, goes much faster. And it's not rocket science. You can imagine why. Like, gravity is helping you, and you're in a comfortable position that you feel you're in control, and very little help from outside is needed. So think about that. If you are pregnant, just know that you can listen to your body, that any position is right. If you have a birthing professional that is not comfortable doing birth in any position, then you might have to consider changing a birth professional or teach them, because I think there's a lot of teaching that needs to be happening. It's not that I don't really want to, it's just that I are very uncomfortable doing them. They might think it is actually more work for them, and it's more you're less in control, because you can imagine if a woman is standing and you need to bend down for that baby whatsoever. But then what I've learned and what I'm trying to explain when I do the workshops with professionals, birth professionals, is for them to realize it's going to make their life much easier too. Because just imagine now you don't have to have augmentation of labor, that you have to put up a drip and strengthen the contractions because labor is not going well, because the woman is active and we don't interfere and the gravity is at work and all those things. The hormones fires up and it will actually just unfold naturally. Then imagine second stage, especially for first-time mommies, they normally can really take long if you're lying on your back and you have to push upwards. And then you need to have maybe assistant delivery and a doctor need to come in. You need a vacuum or a forceps and maybe a cut. All those things is lots of extra work, little extra effort, more stitching. It's more traumatic. Then Worst case, obviously, is that you need to have a cesarean section. So it's high intervention rates. Cesarean sections also cost a lot. And then it's a longer stay in a hospital. And it's just a cascade of interventions. And oftentimes then we think like, oh, wow, I'm so glad I was in a hospital and I had all this stuff happening because they saved my day. But unfortunately, what actually was the reason of is that we haven't allowed natural birth to do its thing, and haven't empowered women, and we actually as professionals has caused this to become a disaster most of the time. Yes, there is a place for interventions, don't get me wrong, but it should be a very small percentage. Say a justified percentage of a cesarean section rate in a country would be 15%, whereas that is a WHO recommendation. In certain countries like in the Netherlands and Norway, Sweden, where they're very pro-midwife and pro-natural, it's below 10%. So if your country's cesarean section, and in South Africa, unfortunately, in the private sector, it's 78 to 80% average cesarean section, then there's something really wrong in our approach to birth. Very, very wrong. And then the doctor didn't save the day. He caused the complication. You need to know this as a woman. If you are a doctor, you're listening to this, you need to empower yourself. If you're a midwife, you probably know this and feel disempowered, or you also didn't know and you also need to empower yourself. But this can't carry on. It's an injustice to moms and babies and to our healthcare systems. We incur all sorts of costs that are totally unnecessary. And if you are into the birthing business to make money, and that's why you want to make all those cesarean sections, then I pray that you will get convicted, because it's not right. It's not right. And I'm so passionate about this. And I don't talk theory. I've learned this in practice. Moms have taught me about natural birth because they have allowed me to be in their space and let nature do its thing. And it's the most beautiful thing. It really is the most beautiful thing. Nature makes provision for everything. You were pregnant, you couldn't do anything about that, really. It unfolded. Same will happen if we would let birth be. It will unfold itself. All right, so a lot of empowerment is needed. For moms, you need to be aware of it, know there's different positions. And for birth professionals, you need to be empowered. If you want to be empowered, we are here to help you. So we've got beautiful antenatal classes where we empower women about their endocrinology, how their hormones help them, different birthing positions, etc. There's a lot of empowerment for you in our online academy. If you're a midwife or a birth professional, we empower you too. We offer workshops, and they are very successful. Last year, we did actually a workshop in a government hospital in New Somerset Hospital, right in the Cape Town. It is actually the oldest hospital in our beautiful country, South Africa. It's also from way back. It used to be the academic hospital before Groot Schuur. And we've got some sensitive midwife champions there, and bless them, due to them, there was an opportunity for us to come and train the entire staff on natural birth and on the hormones and endocrinology. And from there, they totally clicked why you want to have an active birthing environment. And they clicked why you want to have births in different positions. And we left them with a birthing stool. And those midwives testified that they felt like new midwives. They felt like, oh my word, I never even knew there were other birthing positions. They're putting it to practice. They say it's so much faster. It's so much easier. So for them, it also made their lives easier. So yeah, if you want to be empowered, we are here for you, and let's be part of the change. It can happen in our generation. We can bring back birth the way it's intended to be, with beautiful, beautiful natural births. Natural is the way to go. It sets you up for a good parenthood. It sets breastfeeding up. It will decrease all sorts of complications. Also for baby, less postnatal depressions, empowered moms. Just imagine that, man. It is just what we need. So let's Not dis-medicalization, but let's be wise. As modern people, we have sometimes become a bit stupid, unfortunately. Let's be empowered in our bodies and in our skills and bring birth back. And that is going to be our massive mission for this year. So be on the lookout for all sorts of empowering podcasts and content, and all sorts of aids and how we can get this done. And also be on the lookout if you're a professional, or reach out if you want to have any training done in your hospital or in your birth center. We are here for you, and we are so excited to start this birthing revolution. Well, actually just continue with it. It's not just us at Sensitive Midwifery. If you will do your research, there's much going on about it. And as I said, it is enforced now by WHO guidelines. If you're interested, you can go search those guidelines. It's WHO 2018 recommendations for intrapartum care. And then you will know you've got research behind you, and that can be a weapon in your hand. Also, what is very exciting to me is that a new South African guidelines are getting published very soon, and they have also benchmarked off these guidelines. That's why WHO make guidelines for countries to take that and put it in the context in the country. And the first chapter of our guideline is all about respectful maternity care, which brings woman-centered care back, where the woman is at the center, where we need to treat her well, and where she can have a companion of choice. That is not just a nice have to have, it's a have to have, that she can feel supported, whether it's a doula or an empowered partner. Partners also need to be empowered. So if you're a partner, listen. So that is really exciting. Then there's also the thing of women can give birth in a position of choice. That also is already on our partograms that we use as midwives in hospital settings. In the government, there's like a block that says where you can fill in the birth position of choice. So whether you like it or not, this is enforced from upper hand now, back to the basics, back to more natural approaches, less medicalization, because finally research have realized that Mother Nature knows best. So isn't that exciting? I'm excited about it. Nothing is stopping us to move forward. It's also exciting time for midwives to just take their place back. Midwives, you are the expert when it comes to natural pregnancy, natural birth, and so forth. So take your place and show how it gets done. Don't say, but what about the doctors? The truth is, most doctors have been taught by midwives. So it is how we teach them what they take home and in the rest of their life, what their experience is for natural birth. So there's no excuse. You teach your doctors in your academic environments when they're juniors, and show them how it gets done. Right, so that was me for today's podcast on labor and birth positions. In a nutshell, again, what labor and birth positions are best. The best is what feels most comfortable for a woman. And that can be standing, it can be squatting, it can be on all fours, or on the side lying. Or on a birth stool. Water birth also helps you to be in different birthing positions, and whatever is most comfortable. Hope you enjoy that. Hope you're excited for your birth, and if you're not birthing yourself, that you will make it happen for other women. And I'm excited to see how we're going to change birth in our beautiful nation and in the world. Thank you so much for tuning in, and thank you for being a faithful follower. Till our next one. See ya. Bye. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.